Hello, my name is Joshua Boss, and I'm a registered nurse and doctoral candidate student at the University of North Dakota. Thank you for participating in the pre-survey for this project. You will now hear the educational material on oral oncology therapies, which are a guide for improved patient outcomes. The objectives of this education are first and foremost to understand the role that a pharmaceutical nurse educator can play in oral adherence. You'll be hearing about the role that PNEs can play throughout this presentation. We want to understand the rise of oral therapies and highlight the importance of oral medication adherence. We'll define non-adherence and contributing factors. We'll provide tools to boost adherence, explain resources that are available from pharmaceutical nurse educators, address social detriments of health, and finally, leveraging resources that ultimately support patients. This education is split into three sections, the first section being the importance of overall oral adherence. The second section will rely on helping patients stay on therapy, and in section 3, we'll go through resources for patient support. So to discuss the importance of oral adherence and give us a background, overall, the oncology landscape is changing dramatically. There's been a large shift from IV to oral therapies, and oral medications account for 40 to 50% of the new treatments that are released by different pharmaceutical companies every year. Usage of these oral therapies is steadily growing each year, and there are more anti-neoplastic agents that are oral that are being created. And with this, therapies are becoming more targeted, whereas those chemotherapeutic agents are meant, especially when given IV, they destroy cancer cells on a large scale as well as many others across the body. These oral oncology therapies are very targeted to either the mutation that the patient is experiencing or some other specific target that helps the pathway for the continuous growth of that cancerous cell to break down or die, so that ultimately the patient can, in a perfect solution, have a curative solution, or it can slow the growth or progression of the disease. So let's take a look at oral versus IV therapy. Both of these modalities have unique benefits and risks, and understanding them really helps us choose the best course of treatment for patients. And so as you look at oral therapy, there can be many benefits. It's convenient and comfortable. You don't have to have an IV put into your arm. You don't usually have to go to an infusion center or meet with a bunch of different folks or have your labs drawn every single time before you get it. You have less hospital and clinic exposure, and there's the sense of more patient-centered control with oral therapy. As with any treatment, however, there are risks associated with oral therapy. There are adherence challenges. Once that patient leaves the office and goes home, we count on them to continue to take their therapy, report any issues that they're having back to the office so that adjustments can be made, and truly speak up and make the best decisions for themselves and advocate for themselves when necessary. This makes it hard to monitor compliance because as nurses and nurse practitioners, we are obviously not there every time they take that pill to ensure that they are staying adherent. Additionally, side effect management is much more difficult. When you're receiving those IV therapies, you're often in the chemo suite 1, 2, 3, 4 times a month. You're constantly being seen, and the patient even equates those medications to causing those issues, and so they will check in more frequently. Whereas with those oral therapies and the rise of polypharmacy, the patient might not be considering the fact that those medications are causing the effects that they're having and may not reach out as readily. Now, as we think about IV therapy, there are benefits to that. It is a controlled administration. Nurses have to administer it. We know exactly when that medication starts, when it ends, and how much they got. And if they weren't there, we know they didn't get it. It ensures that we have effective drug delivery, that the proper dose is given to manage the disease, and we can make adjustments in real time for side effects. It also provides for immediate access to care should there be any immediate side effects. And again, there are risks, though. It can be inconvenient and it causes frequent visits, whether to the hospital or to the clinic. There can be a higher infection risk because with the insertion of an IV or a portacath, that is an infection point that can enter the body. And there are many common side effects to chemotherapeutic or even targeted agents that arise simply because they're given via the IV modality. Now, let's do a couple definitions. Compliance. Compliance is passive medication taking. If you take a pill, you're technically being compliant. If you're utilizing the prescription as it's in the bottle, if you take them here and there, I mean, that is technically compliant. Adherence is truly the informed and consistent use of a medication, meaning that you take it at the appropriate time every day and that you understand why you are taking it. That is the big crux for many patients, especially who are on chronic use of medications. They may, over time, not truly understand the importance and reason that they are taking a medication. And so adherence leads to timely, correct, and consistent dosing, whereas compliance could be, you know what, I decided to take it this morning, but not this evening because I know it does, it causes maybe GI discomfort for me and I'm going out for a nice dinner and I don't want that. That can still be compliance, but adherence is following the dosing schedule and the use of that medication to the T. And poor adherence, we know, affects treatment outcomes and most modifiable factors for better outcomes. So why is oral adherence important? Well, first and foremost, it ensures treatment efficacy and success. That medication is given for a reason, and if that patient continues to take that medication timely and appropriately, that is how we know if it's being successful, and if it is, that is what ensures that continued success. It can prevent disease progression or resistance if that medication is taken appropriately and timely. Patients achieve optimal health outcomes when they're taking their medication appropriately, and it becomes more cost effective and can improve quality of life. Now, with some side effects, there may be other areas where quality of life is impacted, but if a patient is wishy-washy about when they're taking their medication and how often, it could lead to more hospitalizations or ER visits because of side effects or disease progression, etc. And it helps physicians and nurse practitioners make accurate dose adjustments when necessary. So there are some risk factors for non-adherence: patient education and gaps in knowledge. Also, the complexity that medication regimens and polypharmacy brings really lead to the potential for a patient to be non-adherent. The number one is side effects, and often we don't think about the side effects of oral medications, and we think that they're not as unique or detrimental to a patient, and that could be nothing but farther from the truth. And often patients may not be reporting those as necessary, and a patient will decide to stop taking something simply because of the side effects. Also, there is a lack of social support for some patients, and if they don't have that family member or loved one who they are getting encouragement from to continue to take a medication or maintain that medication history for them, they may not be as apt to continue on their medication. Additionally, mental health issues and lifestyle factors, whether someone is homeless or has to work many different jobs, things like that can impact their adherence as well. Poor communication with our healthcare practitioners, lack of communication overall, not understanding what we receive in terms of education from our HCPs, all of those can impact. adherence. And finally, the cost of medication. With these new therapies, with the many that exist, the simple fact is that many of them are very expensive and can lead to patients not being able to afford them. And rather than have a discussion with an HCP, they'll just decide not to take the medication. So here's some misconceptions about oral medications overall. There is a general misconception that oral medications are less effective. When you're taking a targeted IV therapy or a chemotherapeutic agent, there's a belief that it acts faster and more immediately and more broadly since it's given intravenously. But that's simply not the case. Oral medications can be more effective than certain IV therapies. There's also the misconception that oral medications have fewer side effects. And that's simply not true. Any medication, whether it be the most complex oral chemotherapy to Tylenol, has a range of side effects for every patient that takes them. Some people believe that it's okay to skip a dose every once in a while when you're on an oral therapy. And obviously, that can lead to a host of issues when on these medications. There's also a belief that oral medications are easier to manage since it's just a pill and it takes you seconds to take it. But what often we don't consider is what about when medications are given in combination with other medications? Or the fact that a patient might be on many, up to 10, 15 medications at a time, and not one physician is necessarily managing how all of those interact and what that patient is experiencing on all of those. The other belief is that a patient feels like sometimes they can just adjust the dose on their own. You know what? I might have less side effects if I take one less of this pill or if I break it in half. And obviously, there are many of those medications that you can't do that with at all either. Another misconception is I feel fine, so I don't need to take this medication anymore. And obviously, there are many therapies that the reason that they are not progressing or having further disease issues is because they're on that medication. And if they were to stop taking that medication, they would start to have those issues. And finally, oral medications do not require regular monitoring, which again is not true. There are many that might require more monitoring as you start that therapy, but truth be told, especially on a long-term oral oncolytic therapy, you need to be monitoring that patient somewhat regularly to ensure that they are still receiving the benefit and not having any side effects or issues with that medicine. So let's move on to section 2, talking about how we help patients stay on therapy. And the goal for this section is to understand the role of PNEs in oral adherence, empowering patients through education, how to coordinate with care teams and who is on those care teams, what smart medication tools are available to us, how to track and support adherence, and how to address social and systematic barriers. So let's take a look at the integrated care team for every patient. First and foremost, pharmaceutical nurse educators are part of this care team. Now, they don't work in the office, but they are your subject matter experts on specific medications. When we are working in clinic and we have so many medicines and these new medicines that come out every year, it's really difficult. And we have many databases and resources to look up some of these knowledge pieces that we need to know about these medicines. But honestly, having a nurse educator in the pharmaceutical space whose sole role is to understand how these medications impact your patients and what you can do as a healthcare provider to support your patient, that's real. It's invaluable. And so please remember that these pharmaceutical nurse educators are part of your team as well. And while they might be called something different at different companies, at the end of the day, they are here to support you, and they're not here to sell you anything. They just want you to be able and empowered to take the best care of your patients. We obviously have our oncologists who are involved in treatment planning, education, and monitoring. Pharmacists who can do medication counseling. They can provide different medication tools, and they often do much reconciliation between medication types. We have social workers who can provide resources on financial aid. There are obviously us nurses who helped with symptom management. We provide education, And more often than not, we're doing those frequent check-ins with patients, whether through a triage line when they call in, or doing reach outs as an oral adherence nurse, or any numerous number of roles that we can reach out and say, hey, how are we doing? Dietitians can provide nutritional guidance and individualized plans for patients on their therapy compared to their lifestyle to ensure that they can mesh together and they can have the best experience. Mental health practitioners can provide counseling and behavioral interventions. Often forgotten sometimes is those primary care physicians. And in the oncology world, sometimes those PCPs don't want to touch our patients with a 10-foot pole, but really involving them in the health management and collaborative care of those patients can help ensure that those patients stay adherent, especially once a patient, for example, might be done with their treatment course in early breast cancer and have now moved into the stage where they're on their endocrine partner for the next 5 years, and you don't need to see them except once a year. Involving that primary care physician can help with the adherence of that patient. And then finally, nurse navigators in many offices, which is becoming more popular, especially with the reimbursement of that type of HCP. They can provide care coordination, scheduling, education, and can more often be ones who can reach out to patients and check on their adherence. So here are some patient education essentials. As I mentioned, we want to leverage PNEs to be the expert on that one medication. When we're in the office, again, we have so many things that we have to keep track of. Let's reach out to those PNEs who are the subject matter expert for that medication and let them be the resource for you. When we're educating a patient, we want to explain why we're taking that medication, share treatment goals, and the benefits of adherence. We also want to manage the effects that that medication is going to have. So identify the side effects they might experience and when they might experience them. Some of these side effects may not come for 3 or 6 or 12 months once there's been a buildup of the medication in the system. We need to make sure that not only are we educating the patients on when that's going to come, but when to reach out and for us to check back in at those touch points as well. We also want to help them build routine, use schedules and visual tools. Often your PNEs will have some kind of tool, whether it's for you or for the patient, to be able to monitor how they're taking their medication, when they're taking it, etc. Especially in those more complex regimens, you don't have to build something; your PNE may have it for you. You might want to leverage reminders and technology for help, and there are a lot of great resources, but also reach back to your PNE because different pharmaceutical companies provide different forms of support through technology, whether that is a nursing center that can reach out on behalf of the patient and say, hey, how are things going? What can we help with? They can also be that intermediary between you and the office if that patient is experiencing issues. But they might have specific resources, whether it be a phone app or some other resource that a patient can use to maintain their adherence. And then simplify information. You want to make sure that we are at about a 4th grade reading level, that language is very clear, visuals whenever possible, not just a page of words. And the most important thing is to use the teach back method. If we are going to educate our patients on what they need, and how they need to do it, we need to ask them, can you please teach that back to me so that I ensure that you understand what I taught you? So here are several different medication management tools. When we're talking about education, there can be videos, pamphlets, guides, and obviously, as I mentioned, reaching out to that PNE who often has a wealth of resources, whether that's just for you as an HCP or can be patient-facing as well. There are digital aids, alarms, simply setting alarms on phones, utilizing reminder apps or smart pill dispensers. You do have to make sure you're following the prescribing insert of any medication if you can or cannot take that out of the original packaging. But it has been found that if a patient uses a pill box, for example, that's been helpful. But it's also been shown that if you use the actual blister packs of the medication, if designed well, that can also help ensure that the patient takes therapy when appropriate. Simply utilizing calendars and logs. A lot of pharmaceutical nurse educators are going to have some kind of resource for you in this way. especially when you're in those regimens where it might be 3 weeks on, 1 week off, or 2 weeks on, 2 weeks off, whatever it might be. This helps track doses and adherence, and something that the patient can bring back to those follow-up visits to show when they've been taking that medication. But also, it doesn't have to be that complex. Simple as a printed out calendar or a notebook works too. Integrated systems, whether that be your EHR portals. If you're using wearables, sometimes certain watches will be able to allow you to utilize apps connected to the phone to check off whether you took a medication or not. And then some pharmacy services, whether it's yours or a specialty pharmacy, might have resources available for you to give your patient to manage their adherence. As I mentioned, organizers and packaging, whether it be pill boxes or a color-coded system based on time of day. And then sometimes that unit dose packaging can help keep that patient adherent. Think of the birth control pill in that 28-day cycle. It can help you see exactly which day you're taking. And so sometimes the packaging can be your adherence tool as well. And the most important thing, as I mentioned, is support and follow-up. We have to check in as often as possible with our patients and provide opportunities for feedback from them, whether you're reaching out to them or they know when to reach out to you. So when we talk about assessment and monitoring, education and collaboration is key. Collaborating with your care team and reinforcing with your patient so that they understand why they're taking their medication and how often. Utilizing a pharmacist when appropriate, setting goals, especially when those patients are just getting started on therapy. I want you to get familiar with this. We're going to check back with you in 2 weeks. Even if that just needs to be a nurse visit, if that's not happening in your institution, is that something that can help? And then again, turning to PNEs for those resources that they have. Follow-up and reporting, scheduling, getting ahead of it. Once a patient starts on therapy, especially if they need labs for the first several weeks when you're initiating therapy to monitor counts, etc., let's just tack on a nurse visit to ask questions, having discussions about what that adherence looks like to ensure that the patient continues to be adherent, as well as those self-reporting tools. When we talk about symptom management, those diaries, continuous education, and then truly involving the caregiver so that there is someone other than the patient to be able to monitor for those side effects as well. Many adherence tools, whether you're going to use the electronic health record as ways to check in, reminders via an app, or even if your EHR can build those in. Doing pill counts will also ensure when you do check-ins can make sure that the patient is taking the meds as appropriate. And then alerts from the pharmacy, or if the pharmacy is checking in with a patient, or if that patient has not refilled the medication or refills it too soon, that can give you an idea as to whether they're staying adherent as well. You want to utilize support systems, whether checking in via telehealth, if that's an option, caregiver training for family members, and then the use of motivational interviewing also helps when you are the one who is going to reach out to that patient and check in with them. And we'll go over some skills with that in just a moment. And then your initial and ongoing assessment, checking in on the health of the patient, their financial needs, and their biometric evaluations. Oftentimes we start someone on their oral therapy and we send them off to go and take. But what if they lost their job 3 months later, and along with it their insurance, and now they can't afford that therapy? What if they put on 20 pounds or lost 20 pounds, and that's impacting the side effects that they have? We have to create these feedback loops and have ongoing touch points with patients to ensure that they can stay on therapy. So as I mentioned, motivational interviewing is a really important skill for a nurse to have to understand the behavior of what the patient is going through. And motivational interviewing is truly a patient-centered technique that is used to boost motivation for that behavior change through empathy and acceptance. And so the key to motivational interviewing is open-ended questions. I have been asked myself by fellow nurses when I go into an office, hey, are you taking your medication? That is a yes or no response, and it leaves no room for a discussion. And so, more importantly, it would need to be something like, tell me about how your therapy is going on X or Y. This encourages a detailed response from the patient. And yes, it could be good or bad. And then you're going to have to dig a little deeper on that, but make sure that your questions are open ended. The other key is reflective listening. You want to echo concerns of that patient to deepen understanding and promote self reflection. And so, if a patient is complaining of a specific GI side effect, you want to make sure that you acknowledge that seems really uncomfortable, and I can't imagine what it would be like to go through that. Help me understand how I can help you, or here are some things that you can do. How does that sound? You also want to make sure you summarize what you're hearing and what you are teaching as you go through. Recap those key points that help guide the discussion. And then you also want to affirm what you're hearing, reinforce the strengths and progress to build confidence, especially on those regimens where patients, maybe the side effects are starting to outweigh the benefits in their mind. You need to remind them what it is that the purpose of that therapy is, the benefits they receive, and if it is too much for them, are there opportunities for down dosing? Are there opportunities to reach out and have a discussion with a physician or the nurse practitioner, etc., to see what we can do for that patient? You also want to make sure we remove barriers to adherence. So you want to leverage partners. Let's say there's a medication that needs to be taken and it requires ECGs, and you're in a very rural office and you don't have an ECG monitor in your office. You have to send them all the way over to the hospital. It's out of network for them. Maybe that pharma partner actually has a solution for you. Maybe there's another medication that requires a REMS program. Let that pharma nurse educator connect you with the appropriate resources that can support that patient. You also want to provide education access. That builds health literacy. There are also community classes out there. There are different handouts, and many pharma companies are going to have handouts that are for the patient to support them as well. Have that patient reach out to social networks and peer groups, patients who are on that similar therapy, to share experiences. When there are economic issues, connect with that social worker and again, that pharmaceutical company to see what kind of financial aid can be provided. When it's outside of cost of medication and there's issues with job or insurance, let's reach out to the different resources through our social worker to help those patients as well. When it comes to healthcare access, care coordination is key, especially for those patients that you've returned back to their primary care provider. But we want to make sure we have some kind of follow-up, even if that touch point is only via phone or telehealth, and ensuring that that patient has some kind of resource to connect back when necessary. Think about the environment for the patient. Many patients have issues with transportation or housing or access to pharmacy. What can we do to break those down? There are many resources that can help with transportation, such as, depending on their particular disease state. I know that there are a lot of organizations that can provide transportation to and from appointments. Many of the transplant houses and things, when you have many blood disorders, if you're getting bone marrow transplant, can provide housing. And then pharmacy access too is a mail order pharmacy, a solution that can be found. And then when we think about the whole patient, there are many different cultures that we experience when we're taking care of these patients. And then if they, also have different mental health situations, we want to make sure that staff gets sensitivity training, that we have language barrier training so that everyone can receive care appropriately, and then obviously mental health care resources as well. So finally, let's talk about what resources we have for patient support. First and foremost, those available resources are those nurse educators in the pharmaceutical space. We have nurse navigators, whether that is with a company that can support that patient or in the office. Medication apps, websites, what financial assistance you can find, whether through pharmaceutical companies or foundations. Those charitable organizations, which are often linked through those charitable organizations as well. And then finally, professional organizations as well. So what, as I've mentioned many times, what can the pharmaceutical nurse educator truly do for you? They can provide disease-specific medication information. They are truly the subject matter experts on what that particular medication or suite of medications the needs are for your patient and you often as well. They can provide support for patients and HCPs. Depending on the company and what they do, they might provide direct support to patients, whether through visits that they provide or through a hub where they will reach out to the patient to get them started on therapy and provide check-ins, or if it's just education materials for you to understand the disease state and the medication better, or pass through you to your patient. They can truly help optimize treatment outcomes, taking that barrier off of you to have check-in points, whether through a nursing hub or to provide you tools that help patients get the best possible experience on that therapy. And then they can also offer tools to overcome many of the medication barriers that we just discussed, whether it's financial or access to medication. They have many of those resources. So while there are many navigators that exist within offices and they can help truly on the ground, there are also many navigator programs that your pharmaceutical nurse educator can provide through the company that they represent. A patient navigator is obviously non-clinical often, and they can bridge care gaps and address logistics, culture issues, values like that. And then there's nurse navigators who are clinically trained. They can coordinate cancer care and they can guide the patient journey. Both of these programs are offered by many different pharmaceutical companies. And again, they can take that burden off of you and your office with the many, many patients that you have. They can be another check-in point and often will reach back out to you because they're not providing, obviously, immediate care. When they sense issues, they can reach back out to you to make those connection points. So they can really be a partner. So as we talk about medication apps, what are the benefits? They obviously can help boost adherence. It's something that is a constant reminder. We always have our phones near us these days. And the use of those apps can help boost adherence with reminders. It can increase safety because it can be an immediate resource that the patient can look into if they have questions or need resources around side effects. Often those apps have links to those information. It encourages communication, especially in a homegrown app that maybe your institution has, or if the app is provided by a pharmaceutical company, it allows connection to those nursing teams to help provide the information that the patient might need. It can promote independence for the patient, truly help them feel like they're part of their care, and empowers them to ask questions when they need to and reach out when they need to as well. And finally, many of them help organize medications, and not just the one medication that the patient is taking for the condition, but also the many others. And with the use of technology and AI, they can often identify points where maybe a medication is going to interact with another, and it allows for discussion with the healthcare provider who prescribed the medication to ensure that there aren't any issues that might have been missed. There are a few medication apps that are out there that are kind of known for taking care of things. Medisafe is the top one that I've worked with. Provides refill reminders as well as many caregiver tools, and you can actually utilize that app as a caregiver versus just the patient. Mango Health can provide rewards for adherence. There's been numerous research on the gamification of learning and tasks. And so providing rewards for that continued adherence is something that can be used to ensure patients stay on therapy. My Therapy is a fantastic resource for multilingual wellness tracking. So for those patients that have diverse backgrounds and different languages, that provides an opportunity for you to point them towards so that they can get education and tracking in their language. And finally, Round Health helps track medications and supplements at a very basic level. And then just remember, again, any pharmaceutical company that you're partnering with or work with may have a resource available for you as well. So as we think about websites, this is something really important to teach patients that we don't think about. What is the criteria for a trustworthy website? How many folks go out there and consult Dr. Google on their condition? And so teaching patients simply the criteria for a trustworthy website would go a million miles in helping ensure that you don't have so many random questions and wrong information from patients. So first and foremost, who owns it and who's funding it? If it's a resource that is scientifically backed, that is key. It's also important to consider, obviously, if it's run by the company that made the drug. Are they going to be potentially a little biased? Yes. But will they also have the full FDA required information available? Yes, they will. What's the information quality? If it looks like it was a blog that's been updated by, everyone who's on that medication, not to say that's not helpful for the patient, but is it credible? And so what is the quality of the information? What is the review process for that medication, and how often does it get updated? And finally, what's the privacy of that information? Especially if you're interacting with that website, is your data going to be protected, and how are they going to utilize it? So just a handful of oncology websites that are really key for patients to know. From a government perspective, cancer.gov is a federal cancer research agency. Medline Plus is a consortium of consumer health info. And CMS is our federal health insurance program. All of those are verified and trustworthy websites to seek information. In terms of research, clinicaltrials.gov is a research study registry. The American Society of Clinical Oncology is a research and advocacy organization, and they also provide professional support. The many different disease-specific research organizations, whether it's the Breast Cancer Research Foundation, Livestrong, the Ovarian Cancer Research Alliance, all of these will be fantastic resources for patients to point to. And then you have your not-for-profit organizations, the NCCN network, which is the Cancer Center Alliance, and they also provide guidelines on oncology care. The American Cancer Society, they provide cancer education and support. Triage Cancer provides education and navigation tools for patients. And then the National Foundation for Cancer Research provides funding for cancer research, but they also have quite a bit of information on their websites as well. As we think about additional tools necessary, individual medication websites. So think about the medications being prescribed. There are usually an HCP-facing website and a patient-facing website. Don't be afraid to push your patients that way. Whether you connect them to the resources that a pharmaceutical nurse educator can provide, or they go find it themselves, it is another tool in the toolbox for them. It can provide the prescribing information for you from your perspective, and often there's a way for you to connect with those PNEs to request in services or further information. The Oncology Nursing Society has a toolkit which provides oral medication guidance. And CODA also has education sheets which provide drug and side effect information on many different meds. OralChemoEdSheets.com provides patient and caregiver resources. And many of your EHRs have built-in drug information and patient education materials to utilize as well. And then we have some additional resources. In terms of financial aid, the American Cancer Society and Needy Meds can be resources. And when we think about charitable and professional organizations, ONS, which is the Oncology Nursing Society, the American Association of Nurse Navigators, and CODA also have many resources for us as HCPs, where you can get resources about medications and their resources without necessarily having to connect directly to pharmaceutical companies. You can obviously connect through them, and they can help you get to the pharmaceutical nurse education resources as well. So as we wrap up, at the end of the day, we want to empower adherence and enhance outcomes for our patients. So as we reviewed, oral oncology therapies are reshaping cancer care, and adherence is critical to their success. Understanding barriers and dispelling misconceptions is truly essential to supporting our patients and providing them with the best outcome possible. There are many people on our integrated care teams, and we have to remember that the pharmaceutical nurse educator is part of that care team. And personalized education helps improve engagement and adherence. And that education is for us as HCPs as well as for our patients. There are many resources such as apps, navigators, Peonies, and credible websites that help empower patients and healthcare professionals. And at the end of the day, remember that your role matters. Nurses truly are the key to bridging the gap between treatment and patient success. Here are a few of my reference pages. And I want to thank you for taking the time to listen to this presentation. Please remember to submit this survey and click the link to the post survey and make sure to take the post survey as well. Thank you again for your participation.